Welcome to a very special episode of Peer2Peer, the podcast brought to you by Rayner. As everyone now hopefully knows, this year Rayner is celebrating 75 years of innovation since manufacturing the world's first IOL. I'm here with the CEO of Rayner, Tim Clover, and Rayner's Vice President of R&D, Nat Davies, to celebrate this milestone, to hear about the company's approach to innovation and working with the ophthalmic community, as well as getting a sneak peek into what's coming next. Welcome both of you, and thanks for taking the time to have a chat.
Hi Ben, thanks. Good to see you.
Hi Ben.
Yeah, good to see you guys too. So Tim, it's a massive year for Rayner. 75 years since the invention of the world's first IOL. Absolute, probably one of the biggest surgical game changers the world's ever seen. Can you tell us a little bit about that journey?
Yeah, sure. Actually, it's longer than the 75 years. So Rayner started in 1910 as an optician shop, and over the years built up over 200 just in the UK. And one of those was in London, and was actually Harold Ridley's opticians. So when he had this sort of amazing brainwave after seeing patients who were Spitfire pilots with little bits of the cockpit in their eye, I guess it seems logical that he went to his local optician, and one of our optical designers, a gentleman called John Pike, and Harold Ridley. The story is, I don't know if it's apocryphal, but the story is they sat in his Rolls Royce to keep this secret and designed the world's first intraocular lens. But it wasn't that easy because Perspex was made by ICI and it was controlled during the war effort. So they needed to elicit the help from a guy called John Holt from ICI to get access to the Perspex. And then I suppose in the wonderful days before regulatory affairs as we know them today, Harold Ridley went to implant the lens in a patient in St. Thomas's. And the rest, as they say, is history. So when I joined the company in 2014, it was still a split business between ophthalmology and cataract. And we took the decision to focus entirely on cataract surgery. So we sold all the opticians business. And with that proceeds, we built what I think is probably the world's most advanced IOL factory, still on the south coast of the UK, and we set about reinvigorating a fantastic company by investments in R&D and eye science. But I suppose the thing I'm particularly proud of is, Rayner developed the world's first IOL with Sir Harold Ridley. But what we've tried to continue to do is build an R&D and an innovation function which prioritizes working with and collaborating with the great surgeons today, because that's frankly where the best ideas come from. So we're always trying to design ourselves as really the partner of choice for surgeons with great ideas.
Yeah, and in the last few years, congratulations to both of you, because Rayner has really come out of the gates. I know that for both of you, it probably hasn't. You've seen this coming. It's been a long time coming, but it does feel in the last few years it's really going ahead in leaps and bounds.
Well, I think that it's probably fair to say there was a little bit of catch up at the beginning, and then the truth comes in: can you continue that, and can you start to really lead in terms of innovation? And certainly, I feel that the whole team at Rayner is doing that.
And Nat, all the marketing people and people with podcasts like me like to take credit for spreading your great R&D work, but at the proper coalface, Rayner's being committed to developing new innovations every year. I imagine that's pretty challenging. Can you tell us about some of the challenges that you've come across with introducing these new technologies and launching them during this innovative era for Rayner?
Yeah, sure. I mean, I still remember sitting down with Tim in 2014, and he sat down with me and said, right, Nat, tell me about your R&D pipeline. And it was a pretty blank piece of paper, honestly, at that time. And a very, very small team. So one of the big things that we had a pretty intense discussion about it and trying to work out what we were going to do for the next 10 years. The other thing we decided at that time was that we didn't want to be a Me Too company. We wanted to have something unique, something that was pushing industry forward with every new product.
That's awesome. That history of partnering with surgeons, I know it brings innovations, but I'm sure it's not easy as well. Who have you partnered with, and how has Rayner become the partner of choice with these surgeons? Because it does genuinely feel as though you could go to Rayner with an idea, and if it wasn't too bizarre, you would actually be helpful to work with.
I think almost every single lens that Rayner's ever developed over that 70-year period has been done in collaboration with one or more surgeons. And that's an amazing history, and it's something that everybody at Rayner really believes in. We love to collaborate. One of our great strengths as a company, I think, is internal collaboration. So everybody in Rayner is pulling in the same direction. Every product we develop, it's not an R&D product or a project that just comes from an inventor. It's 20 different departments in the company coming together to work to launch a new product, particularly with the time frames that we set ourselves. And launching a product in 2 years is a big challenge. We love to work with people. We love to work with surgeons and inventors and startups and even smaller companies. That's something that we really enjoy. And we do things in an agile way. We can make quick decisions. I speak to Tim every week, and if someone comes to us with a great idea, Tim and I sit down and chat about it and say, what do we think of this? And if we think it's good, we'll progress it quickly. And you can see that over the last sort of 15 years or so. I mean, I've been with Rayner since 2004. In that time, we partnered with Professor Michael Ammon with the Sulcaflex platform. It's one of the first add-on lenses in the world. Further on from that, not directly surgeons, but when we developed our trifocal lens, that was with a leading Austrian research organization, so slightly different sort of collaboration there. Then more lately, obviously, Professor Graham Barrett on the EMV lens was a really fun project to take his patent, take his idea and turn it into a real range of lenses. And then on Galaxy, of course, we've been working really closely over the last 2 years with Professor Lyra from Brazil. And that's been a really great experience as well.
And Tim, with the innovations at Rayner, you've obviously launched the Galaxy lens, which is, everyone's excited about this. I think I've got a first implantation coming up hopefully next week. So very excited.
Great.
Yeah, it's really exciting. Can you tell us a little bit more about that and how that came about?
Yeah, so actually we're not a one-stop shop, right? So we do less than some of the big guys in our industry, but so therefore I think there's a responsibility on us, so that what we do we do better, or we aspire to do better. And part of that is also our investments in things like RayPro, where we're not afraid to say measure the outcomes, because we think you're going to get better outcomes from these lenses. And when you look at those results, you see some phenomenal data. So if you look at trifocal, which is our kind of current standard of full range of vision lenses, you'll see typically around 95% satisfaction levels, which is out of this world if you're Walt Disney. But if you're an ophthalmologist operating on 100 patients a month, you don't want 5 patients coming back really pissed off because they're dissatisfied. So it becomes a 5% dissatisfaction is an issue in ophthalmology. And the reason they're dissatisfied is dysphotopsia. So, or at least in the findings we have. So that's become an obsession for us. And Nat and I have really been sort of working on how we resolve that and what the next leap of technology is. And as AI starts to sort of abound everywhere in our lives, it seemed a fairly obvious road to go down. And meeting João Lyra and Logos Bioscience and their involvement with a neuroscience AI engine called Vortex gave us the ability, I think, to think things that were beyond our initial capacity, and to be able to really ask that question: how do we get full range of vision with a minimum dysphotopsia? profile. And out of that came this, honestly, slightly crazy optical system of a series of concentric spirals with power changing down the spiral and between the spiral. I mean, 100 years ago, I studied optical physics, but it's really hard to conceptualize what's happening to light rays. And I guess that's the point of AI, that it can think beyond, you know, where sort of humans can conceptualize. So we were excited about that technology and took the leap of faith to have it implanted in patients. And the data came back exactly as was predicted, which enabled us to go to our notified body, submit the data, and happily get MDR approved CE mark for Galaxy, which I think a lot of people saw that data and were excited by it at ESCRS. We've subsequently filed to the FDA and received an IDE for the product. And in fact, we're already on we've already had a number of implantations in the US as part of that pivotal study. So we think it's the next generation of optics, which are going to deliver really outstanding patient benefits, and I hope displace the what is today basically a trifocal market.
Yeah, I think it will. Despite being a refractive surgeon, I failed optics and had to resit it. So I feel like I've got a good excuse not to really understand how it works, but that's what AI is there for. Nat, you know, you spoke about this lens pretty much coming out within 2 years, which seems very rapid to a layperson like me, you know, going from concept to implanting in the eye. I'm sure there were some big obstacles along the way during the design and the testing of the IOL. How did you cope with them? You know, how did you keep this project going and actually get the lens into an eye?
So I think the first important point to make is to recognize the incredible work that our partners in Brazil did and achieved over the years preceding their relationship with Rayner. So we owe an enormous debt of gratitude to them for all that work, and builds on that collaboration point. Again, we couldn't have done this without them. But if we talk about how Rayner and Logos together brought the lens to market over this 2-year period that I mentioned, it's a function of 20 or more years of innovation coming together. So we couldn't do a project like that. And worth mentioning at this point that it's the first time in Rayner's history that we've launched not only a groundbreaking, I hope, industry-changing new optic, but we've done that with the toric version launching at the same time.
Yes, thank you very much. We love our torics down here. Yeah, thank you.
So I can find, after 20 years of launching exciting new lenses, and within 1 day of launching it, I have somebody coming to me saying, "That's very nice, but when's the toric version coming?"
Yeah, that's me. I'm sorry.
And I have to tell them next year. So it was really great to be able, amazing to be able to do that. And we have incredibly strong processes to ensure that every project follows the same steps, the same phases, or that all the right things are done at the right time and the right quality checks are put in place. That's the systems and the structures that enable us to do these things so quickly. But also from a technology point of view, we're taking in Galaxy optics are obviously an incredible innovation, but they sit on this platform, this tried and tested platform. I think we're in excess now of 6 million RayOne IOLs implanted. So we have incredible faith in our hydrophilic material, in the platform, this beautiful, stable platform that we put these optics on. So the haptics and the enhanced square edge, with great PCO rates. We have this RayOne injector, which every single Rayner lens goes through. And that injector was 10 years in development. So all of these things, together with our capabilities in optical design, in machining advanced optics, in measuring. I mean, you can imagine the challenges in trying to measure a Galaxy lens, and we measure every single lens that leaves our factory. So you have to have a check in place to ensure that every single lens meets the quality standards, meets the optical performance that you've set out. So all of these things have to come together, and then that enabled us to launch this lens within 2 years, which was a phenomenal achievement.
It's amazing.
And
Congratulations.
that makes it sound easy. All that happened basically for 2 years was he came in and complained about how really difficult it was to make this thing.
I knew it. I knew it. I was almost going to say, I bet you get sick of people like me saying, "Oh wow, in the last couple of years, Rayner have been doing amazing stuff," and you're like, "I've been
Just
working at
knocked
this
it up then.
Yeah. So
I
yeah,
think it was a lunchtime one day.
but I mean that long pipeline process, it must be exciting also seeing what's coming out and knowing it's going to be a game changer. I think there'll be a lot of people listening who would really like to know the obvious question: what about someone like me or another surgeon who's interested in developing a new technology? I'll send you my ideas later. Do you have any advice for someone that might think they've got a great idea and wants to, interested in developing a new technology?
Yes, that's a great question. I guess a few things. Firstly, it sounds obvious, but thinking about the invention in detail, really thinking through an invention, if it's just a conceptual, we have people come to us with ideas that are not really ideas. They're just the wish to fix a problem, which are interesting, and it's great feedback, and it's always really useful and to think about these things. But if you want to come up with a real invention, you have to think through the detail of how your invention is going to work in practice. And that includes the way that it's going to function, biocompatibility. Really important to put the work in terms of some background research. So looking at what else is out there. Are there other people that are already doing the thing that you've come up with? It's a very common thing to come up with a great idea and then find that actually there's someone else out there who's either already done that, or maybe it's already in clinical trials and it's about to come to market. It's really useful to be able to patent your idea. It gives you, makes it a much more commercially interesting product for any company if it's got patent protection. Obviously, that's a complicated process to go through. It's worth thinking about manufacturing. So it might not be your area of expertise as an inventor, but at least starting to think about how easy this thing might be to make. If something's totally crazily impossible to build, that makes it much less attractive for a company to take on, because the manufacturing costs will end up being so high it won't be commercially viable. And then on the commercial viability point, one of the first questions I always ask somebody who's coming to us with an invention is how much would people pay for this thing? Because obviously any company has to balance the cost of manufacturing versus what they're going to be able to sell the product for, and the cost of bringing something to market, which will be, for any product, will be multiple millions of pounds once you build in all of the R&D and the development work and the regulatory costs and the clinical trials. It is a really expensive business bringing a product to market. So it has to be viable when you once you've got your finished product. But we're very, very open to people approaching Rayner. We love to talk to people about new ideas.
And you might not be able to, but can either of you share any crazy ideas that my colleagues might have come to you with that you decided not to go with?
Well, I would say accommodating has been a rich theme upon which to mine. So we've seen all manner of options of lenses that move, that have electronics, and they're great. Honestly, some of them are just great ideas, but it's back to Nat's point. The regulatory pathway is just going to kill it for the cost or something else. So I think that was definitely the richest scene.
Yeah, that was what came to mind when Nat said, you come to us with a statement, but not actually a product, An accommodating IOL would be great. Oh, thanks. That's great.
Or a napkin, which has happened. So.
And so Tim, what's next for Rayner? What are you allowed to let us in on? I mean, of course you're allowed. You're the CEO.
Yeah. So
so tell us and all the competition. What can we expect in the future?
So I think we'll double down on the whole sort of spiral optic piece. So it's quite rare, honestly, that you launch a product and there's no further development that can take place. So I think we'll look to ways of optimizing and enhancing this whole spiral technology. Oddly, there's been no development around OVDs for an awful long period of time. And it's an area we've been investing in, actually. We have our own biomaterials factory now, and that makes R&D so much easier. And so Nat and his team have a interesting set of opportunities around OVDs, which I would love to think we'll be bringing to market in the next few years. And there, of course, we have this fantastic product called Omidria, which will be presenting new data which shows that you can use it for dropless cataract surgery, which is certainly the first time I've heard of products being able to contemplate that, which has a whole bunch of benefits for patient compliance and frankly the environment. There's an awful lot of eye drop bottles used post cataract surgery, and of course we acquired Sophie at the beginning of this year, and there are a ton of enhancements on an already fabulous system which we're working on in the Swiss factory. But maybe for us the most significant is, because many companies sort of launch these products and they stay in a specific region. So we've been putting our bets down on being able to take these products globally. So next year we're hoping to have EMV Toric and Sophie approved by the FDA and taken to the US. And of course, getting FDA approval means a bunch of other countries as well on a global setting. And then we hope to have Galaxy in the US in 2026 following the IDE study.
Exciting. From the OVD front, you know what would be great? A glow-in-the-dark OVD so that you can turn the lights off and see if you've taken it all out of the eye, but it's still transparent. Just putting it out there.
Seriously, you need to go back into that lab and find the camera.
Thank you. And Tim, do you see for Rayner becoming one of the big industry partners that covers everything from biometry to phaco to lenses, OVD? Like, is that the goal for Rayner?
No, I don't think so. So we've always had this focus on patient outcomes. So I'd like Rayner to be much more focused on science, delivering through technology and being able to say to people like you, this is why I think you should use this product, because it's superior, not necessarily because it's kind of part of 20 products that give you an economic benefit.
Yeah, I love that.
So I think when you're looking at innovation, it's not always about, hey, this is a brand new sort of amazing piece of tech. You've also got the ability to, look at the way products are made and either enhance their usage case or sort of extend their claims.
To be honest, even the innovation of removing the paper DFU from the box of lenses, I think has been a good innovation. So lots of different innovations.
There's a bunch of us at the company that are really interested in the environment, genuinely. You only need to look at Nat to realize he's very environmentally conscious there with his beard. But it's something that we are kind of truly emotional about. So, last year we spent quite a lot of money actually moving to EIFU, one of the first we know about. We killed, so I know you use our products, Ben, but we used to have this second tray. That's going now in favor of a kind of environmentally friendly pouch. We've dropped the amount of energy we use in the factory by over 30%. Even acquiring things like Sophie, we run a slide rule over the sort of environmental impact. So multi-use cassettes, environmental friendly packaging, low energy use, all of these things are considered, and ultimately they cost millions. So when I see you and your colleagues sort of talking about wanting to reduce the carbon footprint of cataract surgery, I just hope that we're doing some of the right things to sort of enable you to think, actually, if I use Rayner, they're helping with that journey.
You're ahead of the game. And if I'd known about Nat's beard earlier, I would have been using products even earlier. So thank you.
There you go. You can take it off now, Nat. Job done.
That's right.
Awesome.
Just some comments from me in closing. I think I can't imagine how exciting it must have been for the people at Rayner back in just after the Second World War to get a chance to work with Sir Harold Ridley on that very first IOL and doing something so innovative and groundbreaking. And certainly it's been one of the most exciting things about my job at Rayner in the last 20 years has been working with people such as yourselves, surgeons, inventors, ophthalmologists. It's something that we love. We love to collaborate. And I really encourage anybody out there who has a great idea, who wants to come and have a coffee or a Teams call with myself or Tim, or in fact anybody from Rayner will put you in touch with the right people, the right people or person to speak to. If you've got a great idea, feel free to chat it over with us, or even if you want a bit of advice about taking a great idea, you could take it somewhere else. I'm always happy to give people advice on developing new things. So we'd love to talk to you. Yeah.
Thanks, Nat. Yeah, your team, everyone at Rayner is so nice. I'm not just saying that because I want to keep my job, Tim, but like they genuinely, it is a really nice team at Rayner. You've done really well.
Thanks, Ben. We really appreciate your support as well.
Thank you both so much for joining me on today's episode. As you've heard, Rayner brought us the first IOL through collaboration with surgeons and are continuing this tradition into the future. I'm excited about new innovations being released right now and what's to come also. Thank you, Tim and Nat, for all the work that you've done for our patients. I'll talk to you all again soon on the next Peer2Peer episode. Thank you.
Thanks, Ben. Let me know how that Galaxy goes.
Yes, very excited. Thank you.
Thanks, Ben. Great to talk to you.